Hello, our dear viewers. Welcome to yet another episode of Decent Conversations, where we are all about having lives that work. And I'm your girl, Tabitha Moy. Today, our topic of conversation is on men and mental health. In the recent past, we've seen cases of depression and suicide being on the rise. And some of these statistics show that men are the most affected. Yet we are not having candid conversations to understand what's happening and where the problem is. So today with me, I have a panel that is well conversant with this topic. They are experts in this topic. And before anything else, I would wish for them to introduce themselves, starting with my farthest left.
My name is Onyango Otieno. I'm a poet and mental health advocate. I'm glad to be here.
Thank you.
My name is Margaret Odhiambo. I'm a global health advocate for non-communicable diseases, having mental health as one of the core.
Thank you, Margaret. And we have Salome Njeri, who is our sign language interpreter. So given the statistics that we are having on mental health, we've seen that men are the most affected when it comes to suicide and depression. What are the most common issues that affect them, that bring them to the point of depression and suicide?
So possibly you can start by saying mental health affects both genders nonetheless, but then when you come down to men, is they're less likely to access help when it comes to mental health issues. And there are certain issues that have actually bottled that up, and one of them is we tend to have the traditional gender roles. We tend to tie masculinity to strength, where you rarely find a man speaking up, saying maybe he's distressed or depressed. So that is one of the things. And also the issue of he's supposed to provide. So he's the protector, meaning he's supposed to be strong and be in control. So that is one thing that is killing so many men, and especially when they have issues they need to talk about, but there is nowhere they can go to. And also we also have socioeconomic problems in the country, and different people are affected in various ways. So that is also another issue that has sent so many people into depression. So either issues of employment, unemployment, or underemployment, for the purposes of providing for themselves and also for their families. And also there's rampant misuse of drugs and substances. So people and especially young men, they tend to abuse them, and there are actually repercussions. So at the end of the day, when you find somebody is not able to sustain buying the drugs and the substances, and there's the issue of withdrawal, and then there's nowhere you can go to seek for help. So that is also another issue. And there are so many other causes that actually contribute to such. And maybe we should have started by breaking down what is mental health disorders amongst the men. What is actually the main mental health disorder? And possibly I can say is depression in the country. And for many middle-aged men and also for many young men. So there is depression, and you also have some who are suffering from anxiety attacks, which lead at the end of the day to depression, either chronic or acute clinical depression. So you also have issues of mental bipolar, which is supposed to be a clinical case, but because of the stigma that has been tagged to it, people do not understand what bipolar is. People do not understand what schizophrenia is. So the issue is also there is no information out there.
I feel like we need to go back fast, because mental health is part of the SDGs on good health, right? And probably because in our society, when we talk of mental health, most of the time it's associated with being crazy, and people don't really understand what mental health is. Probably we jumped to the issues before we broke it down. And Onyango, probably you can tell us, when we talk about mental health, what are we talking about?
It's just as simple as the wellness of the mind. How healthy the mind is, how correct the mind is, for normal functioning, for a human being. That will be it.
That's the best definition.
According to me today.
Okay, that's a good definition. Do you have anything to add now when we look at specifically when it comes to men, as Margaret has broken it down? What are the other issues that affect men and we don't know them? Because at times we only assume, emotions are for women. So what are these other things that are affecting our men?
I think in addition to what she said, one of those very deep problems we have, and this is a global issue with how men are brought up, is the socialization aspect in regard to how society understands men should be brought up, and the effects of that, and how the effects of that on their worldviews, their identity and their masculinity, as she mentioned. So you find that people confuse physical strength and mental strength from a very young age. So the notion that boys are stronger than girls is also understood that even mentally it's the same. And it goes also in all aspects of how these two genders are treated, right? And so you find that, as girls grow up, they have more avenues to talk, to express themselves, because also that has been regarded as a weak, aspect of things. And so because of strength and, the idea that strength has to come with being, tight and quiet and strong, boys tend to grow up very isolated and quiet, and very naive of their emotions, right? And so you find that because they do not have a language to express what they feel, they nearly only subscribe to anger as a way of expression when there is no happiness, right? And so even the notion that women think through so many things at the same time, I mean, our brains, function the same. We just need more education on what is masculine energy, what is feminine energy, how does it affect the brain, what are these chemicals all about, how does it affect the identity of a human being and how they understand themselves. And so, by these simple issues, you find that boys grow up. I was reading somewhere and it was saying that when we were teenagers, we had very strong friendships amongst each other. And then during adolescence, when all these changes are coming, all of a sudden you start competing with your fellow boys for girls' attention, to show how cool you are, to show that you know how to speak better, you can hustle, you can do all these cool things. And then you get to your 20s and, the idea of independence starts coming way earlier. In fact, boys, the idea of independence is sold to boys way younger, like earlier than it is for girls. Because, you hear stories about, girls only leave their home when they're getting married. But the boy, is told to get out of the house when they're 18, 19, 20, start thinking of how to get out. So these challenges of, being introduced to the world and being forced to grow up before being taught how best to really articulate yourself, how best to deal with your emotions, how best to be an interactive person, how best to be kind, how best to be patient, how best to be honest with yourself, has been one of those challenges that men have been facing. And the fact that they do not have the tenets of dealing with all that's going on within them makes it very difficult. And this is very natural. For example, we say a salty water lake is salty because it only has an inlet and it doesn't have an outlet. And a freshwater lake is fresh because it has an inlet and an outlet. In your brain, if blood does not circulate well, you faint. Your heart, if one artery is just blocked out, you die. And so And it is for all of us. If you have so many things you're taking in, but you're not taking them out, you become a toxic person. All that energy gets inside you. So for what men do, you know, violence is that one way which they express all that frustration out. Or some people get into drugs, as she said, or some people get into sexual addiction, some people get into alcohol, some people get into gambling, some people get just overindulgence of risky behavior. And I mean, it does happen to women as well, but you see, like, even like the rates which men indulge in these issues are way much more, right?
Yeah. There's something you mentioned about how the boy is, you know, there's kind of pressure that you have to go there and fend for themselves, and it starts at an early age, not even at 18.
Yes.
You see boys as young as 5 years being told you're the man of the house. You know, like there's that constant reminder that as the man you need to be strong, as the man we expect you to take care of your sisters, as the man you need to make decisions. So how do we have these conversations on mental health in the African setting, given that there's that patriarchal, we are in the patriarchal society and the limelight is on men? So if a man doesn't meet up to a certain standard, you know, everyone expects this of you. If a man does not provide, you like failing. If a man is not strong enough, there's a problem. If a man is expressing themselves too much, you've heard people saying, we are kona umama. So how do we break that barrier and have conversations about mental health? Maybe Margaret, you can mention something.
So not once have we had when maybe a 5-year-old boy child cries, the parents or just neighbors or families will tell the kid that man up, stop crying. But when a 5-year-old or a 10-year-old or a 15-year-old girl child will cry, then it's okay. We tend to help them. So that is one of the issues that has been there, and maybe one thing that can really come up is can we be able to have accessible places where these men, both young and old and also boys, can go and be able to open up and talk to them. So one thing is the issue of accessibility. Why don't the men go for mental health checkups or just for help? So we can come up with, make sure it's accessible, and those also the issues of engaging. You engage the men themselves, not come and tell them that you're suffering from this mental health, this is how you're supposed to do. It's them. So engage them in an effective way so that they can be able to come up with various ways how they can be able to solve up that issue themselves.
Okay. Yeah. Maybe also you can mention how do we break that so that the conversation is easy?
I think it depends on a lot of things, but first I like to start with the home, and you know, just talking about the usefulness of opening our homes to be safe spaces for all children, to feel they can express themselves, to feel they are safe within the perimeters of their homes, in their neighborhoods, in their communities. And that is tied to also the consciousness of parents, right? How do they understand life? How do they view children? You know, before children were taken as blessings, even as labor, and then now as a source of wealth, right? Not human beings, yeah? And if I diminish your worth and treat you as a source of wealth, then I won't pay attention to your senses, yeah? So if I start treating you as a human being, as an independent entity right from childbirth, then the way I take care of you, the way I talk to you, the way I nurture you will be very different, yeah? And so most of us grew up not being treated like human beings. We were just things in the house. Your voice never counted. You never mattered. Your decisions, like your voice, you aren't really there, you know. You are erased in so many things. It's like you're just a puppet blowing about in the house.
An accessory.
Exactly. And so if you grow up feeling like that, and for a boy, because of all this, you know, conversation about masculinity, When you grow up, you want to exercise that power that was taken away from you, okay? And since you've grown up watching, you know, women being controlled and abused around you, you want to exercise the same. And you want to grab everything you can just to fill that void that, you know, you missed when you were a child. And so opening up safe spaces at home, for me, is one of the biggest solutions we really have. And that means people must start being vulnerable in their house. Yeah, you know, parents need to start showing children that they are not perfect people. They are not all number ones in school. You know, they don't have it all together. Some days there's no money. Some days they're not okay in the house. Some days they're arguing. Some days things are not so fine, and it's really okay. You know, I remember there was a time my dad and mom were arguing, and I kept asking my father, why are you always angry? And he sat me down and he said that he doesn't come to me with his issues because if he does so, I will think that he's weak. And this is a full-grown man. This is how he's always seen life. And I just imagined how much pain must this man be in, so much that he can't talk to his son about his pain, just because his son will think he's weak. So there's that fear of losing power, losing respect, you know, how will he see me, how will they see me, you know? And at the end of the day, you're still suffering. So why can't you just face the fear? And it's difficult because it's also systematic, because that is just your house. So how about your workplace? How about, you know, when you walk out here and, you know, the way you imagine people see you? And I think us in this generation, because we are more informed, we are more educated, we are more exposed, we have to start breaking this wall and just saying, if we are starting to be parents now, first of all, we have to be healing our own traumas and dealing with our mental health the proper way, so that our children can learn from an early age. That will also improve positive coping mechanisms that come with, you know, life stresses, which are always going to be there, and in a nutshell, it will also improve, you know, the health of our communities.
Oh, thank you. I know you really have rich experience in this area, which is kind of based on part of what you've gone through. So I want us to take a break shortly, then you'll come back and pick it from there. Welcome back. This is Decent Conversations, where we are talking about having lives that work. And today we are delving much into men and mental health. Onyango, as I mentioned before, we know you have a journey where to the point that you decided to become an advocate of mental health. And just to encourage more men to talk about this issue, I would want you to shed more light on what you've been through and how you were able to overcome the challenges.
I grew up in an extremely violent home. My parents fought a lot, and that meant they had no time for me. And my dad was also very violent towards myself, and there were very physical and emotional abuses. Now, as a child, I felt very helpless because there was nowhere I could run to. When I'd go to my uncles, they'd say, "Hata sisi tulichapwa." So, you know, and some of those beatings were really, like, they were really extreme. Yes, and by the time I was getting to 16 years old, I was feeling suicidal. And I ran away from home a couple of times, and the last one being the one which I wanted to go and die in Mombasa to just, I'd given up on life completely. And by that time, I had also been expelled from school because I wasn't doing so okay. And so as I kept growing up, I had depressive phases in between. I struggled a lot with relationships, with work. I had to drop out of campus because, you know, the violence at home couldn't enable them to pay for my fees. And growing up was a hustle, man. It was a hustle. So early 2017, from late 2016, I was coming out of a very toxic relationship, and I didn't have a job at the same time. And I remember starting to feel funny, in my brain. Like I was just starting, like I could feel I'm not myself. And it started very, very slowly. So I could tell that I'm not really okay, and I'm not sick. It's not malaria, it's not a cold, but I can't put a finger on it. So by early January, early 2017, the thoughts of suicide started coming back. It was a time when I had lost two of my very close friends as well, and just dealing with that grief was also just very difficult. And I thought to myself, maybe if I joined them, where they are, they're not worried about traffic, they're not worried about rent.
They're at peace.
Yeah, they're at peace, the hassles of this world. And so I remember this day going back home and taking a 2-hour-long shower, just talking to myself and wondering, what am I going to do after I get out of this bathroom? Do I use a rope? Do I take poison? Do I jump from a building? What do I do? And for the longest time, writing has been that thing for me where I just get everything out. So I went online and I put a Facebook post and said, I'm feeling suicidal today, and I'm not okay, and this has been happening to me, and I can't explain it. So many people got back to me saying, me too, and me too, and me too, and there were so many voices, and many of them were just in my inbox. They couldn't write from the public post comments. So it also got me curious, and as much as I was still deep in the hole, it got me curious, like how come so many of us are going through this thing but nobody's talking about it? So because it had been a recurring experience to me, I thought to myself, I have to find out what this thing is, because I fear if it comes back and I haven't sorted it, it may take me out. Mm-hmm. Yeah. So that's when I started searching online about suicide and a lot of stress and stuff. So I came across that term, mental health. I had been reading from certain blogs about writers who had taken away their lives, but they were white people. So, it was very difficult to find African stories about the same. And so I said, that's what I want to do henceforth. I want Africans to tell their own mental health stories, because it's from there that we can even start talking about research and interventions that will be helpful in our own context. Mm-hmm. Because a lot of the psychology that we've been taught is only working in the West because it's theirs. Our cultural context is extremely diverse and very different. So we have to start being curious more about, are there any traditional methods that we may have for social healing? Do we have any other contexts of treatment that we may have that may work for our people or even individually, right? And that meant understanding the information that has been there before and seeing what's been happening here in history that is so difficult to find because we've not been writing these stories down, and seeing how have people been coping. There's an African proverb that says, every market has a mad man, something like that. Mm. Meaning these things have been here for the longest time, we know, right? But the way, because we have not been able to explain them, we take it as this is madness or witchcraft, but because of development and time, we are now just getting to know that these are issues which most of them are actually treatable, and that people going through mental health conditions can also be fully functional and just healthy like everyone else. So when I began writing these stories, I began to understand myself more. I went for therapy, and I started a mental health support group as well, where people just come. For me, I'm using storytelling for social healing, because I feel if we keep quiet, stigma will always be there then. It means we are still feeding the stigma with our silence. But if we come out, if we start talking, if we start speaking up, then we're gonna like help tackle or battle the stigma. So for me, I use storytelling to, people just telling their experiences, so that we can start understanding each other from, this point of view, right?
It's good. It's good to hear that, that journey, because most people have gone through abuse, most people have gone through violence, and very few people speak about it. And it brings now the PTSD that carries on now in other phases of life. And also when it comes to literature, we've had little literature in Kenya, and let's not even say Africa. When you're looking about issues of not only mental health, but issues surrounding socialization, very little literature will be there. But now you, as being a champion, you're helping now bridge that gap, and it's something we need more of. I would say, because I've seen the gap as a writer. I've really seen the gap as well.
Right.
So to get back to the topic, we've seen not so long ago we had a case of a very senior person, an accountant, committing suicide, throwing themselves from the 18th floor. So I would think that mental health is not only an issue affecting us at home, it also pulls in now the workplace. And I would want to ask, what interventions are there to curb these kinds of issues? How can we deal with it in the workplace, in the social places, so as to create those safe spaces?
So one thing with mental health is it's broad. And in terms of having an approach, a multi-phase approach per se, we can say is we can look into various dimensions in terms of prevention, in terms of care delivery, therapy, rehabilitation, and also regardless, we also need to stick to aftercare. So once the person is okay, then the follow-up. So then there is the issue of not only older men or middle-aged men. There's been a very huge number of young men, young adults, killing themselves, committing suicides in institutions of higher learning, and maybe because of various issues. So actually there's some work that has been done, and we are grateful, but still there is much more that needs to be done. So for example, the World Health Organization in the recent past recognized mental health as one of the 5 most non-communicable diseases that affect many people. So despite us having the cardiovascular diseases, cancers, diabetes, and respiratory diseases, we also have mental health in the big 5 of non-communicable diseases. So that is good, because now we have people, a lot of focus being driven to mental health. And also there's been also so many other interventions. For example, the National Institute of Mental Health currently has a let me call the Men and Mental Health program that is geared just for men. So it's a space that generates conversations, solutions that is meant to curb especially the increase in mental health issues. And there's also an amendment bill in Parliament. So, but also the other thing that we really need to focus in is there's the home aspect, having a safe space, and having men and us as the ladies being vulnerable and letting them being vulnerable in the various homes. But still also in the workplaces, we need to ensure that mental well-being is really catered for. If you're able to open up spaces, still the safe spaces in the workspaces, and also the issue of, for example, the drug and substance abuse. So currently there is a law that you cannot fire an addict, and especially an alcoholic, because now that is a disease. So if you're able also to integrate mental health, if somebody is having depression, then we really need to take care of them instead of letting them go, or instead of trying to attribute poor performances with laziness or any other issues. Maybe it's just mental health. There's something beyond. So that is just one of the things that can be done. But mainly is, like he said, the spaces. Just create safe spaces where people are able to talk about it. Because with mental health there's the issue of stigma. So unless we break the stereotypes and the stigma around it, then mental health will still be here.
Because I will want him to elaborate more on the current bill that's on mental health. I will want us to just talk about the stigma, because when you talk about mental health, it also comes with the issues of addiction, the disorders, and depression being the most common. But depression is just a sign of many other problems. So how do we deal with the stigma, and how do we help people break through the stigma?
So possibly stigma. So number one, for example, the bipolar. When you see somebody who has bipolar, the first thing, if you're not aware of what bipolar actually means, you'd actually say the person is either has mood swings, or for example, depression, you say the person is irritable, is angry, is lazy. We tend to tag the issues of, instead of naming mental health as it is, we tend to tag them. So as we are tagging them, we tend to push them away from the society in itself. So they tend to be secluded and suffer by themselves. So one of the greatest things that you can be able to do is be able to decentralize the information. Let the information on mental health float in the public. Let people know that depression is real, and it can affect both men and women, and it can affect people who are of a higher class in the society and those of a lower, let me call them those with from in the aspects of socioeconomic class. So there's also, we need to tell them that there is anxiety attacks and panic attacks, which is actually a symptom for something greater. We need to tell them that if they are irritable most of the time, or they have mood swings, or they're usually angry or withdrawn, then they need to seek help. We need to break down that despite having depression and all these other diseases, we have so many beyond, like schizophrenia and so many other diseases, Alzheimer's and all that. So we actually need to break down this information, let people know. Yeah.
Oh, thank you. So let's get to the bill. And as you expound on the bill, probably you can mention, do you think there are other interventions that the government has done? I know it's cliche to keep saying the government, but at the end of the day, the government needs to work for the people. The government is there because of the people. So as you mentioned the bill, probably you can also share if you know of any interventions that the government has done.
To start with the point on safe spaces, mental health go hand in hand with social justice. Now, if we do not have proper leaders in government, they wouldn't know the importance of talking about these issues. Bad leaders are expensive. They're really, really expensive. And that means money goes to spaces where they're not useful, and to very few people, and the majority are locked out. And that is one of the challenges we are having in the health sector, because the people who are there do not understand the importance of the health of their people, right? And in fact, even the amendment bill we have in Parliament, it has not been an easy journey for the Senator Sylvia Kasanga, because in the beginning, people just wonder, what's this all about? We had a Mental Health Act from as far back as 1989, but it was really archaic. And the Ministry of Health came up with something quite comprehensive in 2015. That, you know, the current amendment bill is just like a product of, you know, a continuation of what was done then. And the goal is to make mental health accessibility and treatment be available in all counties, and to make public awareness something of reach to the Kenyan people. The same way they did the campaign with HIV and AIDS and all those Chill programs and VCTs and stuff, because it's the same thing with what happened with AIDS. When we came here in the 80s and mid-90s, people didn't really understand what's going on, and so the government came up with these programs because many people were really dying. But we do not have to wait until the numbers so high, because they're already going high. In fact, I think we lose more than 1 million people by mental health conditions in a year, and with this rate, especially with non-communicable diseases, NCDs, the numbers are really going up very much. So proper policies are one of the most important ways we can start actualizing these realities of accessibility to treatment. But at the same time, implementation is where the work is at, because we have a substantially okay constitution in this country, but there's still so much corruption, and the majority of the people feel left out. So that's why you hear very high cases of suicide, and the intake of drugs and substance abuse is extremely high, sexual abuse is extremely high, crime is extremely high. People feel frustrated. There's no place. If I am unhappy about something with the government, for example, and I go to protest and I get tear gassed, sometimes I get killed, and there's just chaos all the time, it means I'm not safe as a citizen to exercise my rights. So how is that for the health of a people living in a border with 50 million neighbors? What do you do? Okay, so we are hoping that as this bill is worked on, the government is going to be on the forefront to make information available to Kenyans about these issues. We've been working together with the senator as well to just formulate something formidable that's going to last the country even as they gear towards Vision 2030. There's a lot of work to be done because this is a global conversation, and so many of us are still trying to really understand the in-depth realities of what mental health is all about, because the brain is one complex place, and so with more curiosity, more storytelling, we are going to beat the stigma with more awareness campaigns, and people just coming together and saying we want to feel good, we want to be well. It means we have to do away with discrimination. We have to stand for human rights. We have to stand for social justice, because without that we won't know how to vote. We won't know how to treat each other well, and not on the basis of what we already do, like political class, social class, tribal class, and all these issues. So it's mental health conversations are very much ingrained with our day-to-day life, because how I see you says so much about who I am, and also says so much about my mental capacity or mental strength. And it's not about how educated people are, because people could be educated but they may not be aware, they may not be conscious, right? So how do we affect or influence the consciousness of Kenyans, and by large Africans, on these issues? Because there's been a lot of confusion, because our history being colonial, the struggle of maintaining our African traditions, and westernization, modernization, all these issues are happening within a very short time, and it's really fast. Technology today, 15 years ago, not everybody had a smartphone, and today you have so much going on in your screen, and it's also affecting your mind. So things are moving so fast, and we have to also just be innovative about how we come up with these policies.
Probably, Maggie, I know you're from the Kenya Red Cross. You can mention, I know there are like numbers that people can call that are toll free, because not everyone is comfortable talking to someone, someone physically and opening up. And with the changes, at least we are having some of these things that are there online platforms, the toll-free numbers. Maybe you can mention some of them that people can use.
So there are teleservices that are being provided 24 hours a day, 7 days a week, so throughout. So the toll-free numbers is 1199. You call, and there is a psychologist, a counselor behind that phone, so you'll be able to talk to that person. And the better thing is it's anonymous. You do not know whom you're talking to, and the other person also does not know you, but the intent is to help you out and to be able to build you and just give you the care that you need. So it's toll free, meaning you do not pay any amount, and you can call at any time and just ask for any services that you need, which is 1199, and it's for mental health issues.
Oh, thank you so much. Thank you for being part of the panel. And before I close the discussion, probably I'll give you like each a second to give their final remarks.
For me, I'll just encourage people to tell their stories. Just that. Yeah.
So mine is we need to create a system where we are able to appreciate good health and well-being, and that is inclusive of mental health.
Okay, so what I will say is, from this conversation, we are agreeing that there's no health without mental health. And it's about time we start having these conversations and encouraging people to open up, especially the men, and creating the safe spaces. Avoid the stigma. Everyone could be going through this. If it's 1 in every 4, you don't know if you're the one. So yeah, thank you so much, Onyango, for coming. Thank you, Margaret, for coming. It's been a pleasure having you. Thank you so much, Salome. This has been Decent Conversations. The topic has been men and mental health, and I've been your girl, Tabitha Moai. Good night.